This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Faxapix 2.5 tablet is widely used to manage blood clotting issues. It contains apixaban, which prevents the formation of harmful blood clots. Indications and uses. This medication is indicated for managing blood clots formed in the veins of the legs, as well as preventing blood clots in patients with atrial fibrillation. It also plays a crucial role in preventing the recurrence of blood clots in the legs or lungs, particularly following hip or knee replacement surgeries. How it works. It works by blocking clotting factor Xa, which is essential in the blood clotting process, thereby reducing the likelihood of unwanted clots. Directions for use. Take this medication exactly as prescribed by your physician. It should be swallowed whole with a full glass of water. If you have trouble swallowing, consult your doctor for alternative methods. The appropriate dosage and duration will depend on various factors, including your age, body weight, and specific health condition. Possible side effects. Common side effects include bleeding from various areas such as the eyes, nose, and gums, as well as bruising, anemia, low blood pressure, and nausea. If any side effects worsen, medical attention should be sought immediately. Precautions and warnings. It's important to consult a doctor before use if you are pregnant, breastfeeding, or have any pre-existing conditions like liver disease or high blood pressure. Caution is advised in elderly patients and those with kidney issues. Additionally, avoid using this medication if you have a known allergy to apixaban. FAQs. 1. Is this a blood thinner? Yes, it is an anticoagulant that helps manage blood clot formation. 2. What precautions should I take? Inform your doctor about any existing health conditions before use. 3. What if I forget a dose? Take it as soon as you remember, but consult your doctor. 4. Can it cause low blood pressure? Yes, it can, so monitor your symptoms closely. Thank you for watching. If you have any questions or suggestions, feel free to leave a comment below.